walked you through what it means to be a certified application counselor and how to start that process. And those are the folks that do enrollment through healthcare.gov into ACA marketplace plans and subsidies. Today, I'm going to lead this session and we'll focus on Medicaid and CHIP and what enrollment looks like for, or enrollment assistance looks like for those programs. Aurora, did you want to say hi?
Yes, absolutely. Hi, everybody. And I think just to make sure that you hear us, please, put hi in the chat box. That would be great. Like Melissa said, my name is Aurora Harris. I'm with Young Invincibles, and today I'll just kind of helping Melissa on the tech side while she presents on Medicaid and CHIP Assistance 101.
All right, and thank you, Jennifer, for saying hi. It's nice to get a little audience feedback as I just speak at my computer camera. So one of the benefits of being able to work with the Recovery Fund there in Houston is that we do get to do this with a small sort of intimate group. So please feel free to use the chat box and the Q&A box to ask questions as we go through the content. We do have a small group. We've got plenty of time. So I'm happy to answer questions. These first couple webinars are meant to be that sort of 101 level of this information. But my guess is that the people who are joining us have a varying level of expertise. So if you want me to take it a little deeper on any particular item, I'm happy to do that. So let's get started. I will say, everybody has their own style of how they do things, and my presentation is going to look a little different than Aurora's did, but it also has to do with just the nature of these programs and the history of enrollment assistance in these programs. So let me pull up my slides. Of course, I can't see very well. I've got like 15 things over the top of my slides. I can't hit the button. Okay. All right. So I'm going to close my chat box down. So Aurora, let me know if anyone is in the chat or I need to stop to answer questions. So Medicaid and CHIP Application Assistance 101. The first thing I wanted to start with was how these programs all are meant to fit together, because we had this great presentation from Aurora earlier this week, and I sort of wanted to start with how do we bridge the two? When the ACA was passed, the idea was that if you had an income, household income of below 4 times the poverty level. So you've got this actually says 2018, but I did change the numbers. Those are actually 2020 numbers. I just didn't change the little note at the bottom. So in 2020, if you're a family of 3 and you have below 86,000, you're eligible for some level of assistance paying for health coverage. That was what the ACA's intention was. It didn't, as we all know, it didn't work out perfectly, and we still have a long ways to go. And there are definitely some pieces that we can talk about where there are holes in the system. But that was the intention. And so earlier this week, Aurora talked about how you can become a certified application counselor and that you do enrollment through healthcare.gov. And when you're doing that enrollment, you're enrolling folks into healthcare plans, but with premium assistance. So help paying that monthly cost for those private health insurance programs. So that's what, these are sort of ugly colors, sorry. That's the theme in my template, but that's that yellow at the top, that is just straight up help paying for premium. So anybody between 250 and 400% of the poverty level, they just get help paying for premiums. And the closer you get to that top, the less and less it is a sliding scale. So the less assistance you get. Between the poverty level and 250%, you're getting a couple of things. You're getting both insurance assistant or premium assistance, and you're getting access to health plans that have lower cost sharing. What does that mean? That means that the out-of-pocket costs are lower. The deductible is often lower. Your copays when you go see a doctor or go to the ER are lower, and those are actually built into the plan. So you just when you're in that income range, you get access to those plans to enroll into them. So not everybody loves this slide. I like it because it fits it all together. But you can see my cursor, right? Okay, perfect. But these are kind of lanes. So let's talk about kids first. So if I'm a kid, I'm going to have Medicaid all the way up to 138. Above 138, I have CHIP all the way to 206, and then I start becoming eligible for the ACA. And so one of the basic ideas here, and we're going to build on this, is that you can't be eligible for two things at once, and you don't actually get to pick and choose either. So if you're eligible for Medicaid, you're not eligible for CHIP. If you're eligible for CHIP, you're not eligible for the ACA. You got to fall into one bucket. So for kids, we have this nice line of coverage. As they go up, it changes a little bit. We've got Medicaid and then CHIP and then the ACA, but you've got full coverage all the way across. It gets much more complicated with adults. One thing that many people are very aware of is that if you're a US citizen, you may have eligibility for Medicaid for parents. That box is actually a little deceptive. It's too big. I made it that big so you could read the words, but you actually have to have less than 17% of the poverty level to be eligible as a parent for Medicaid here in Texas. We have the lowest income limit in the United States. So very few parents get access to that, and we'll talk a little bit more about it. And then we have the coverage gap, and we're going to talk more about that, and that goes all the way up to the poverty line. So what happened here, many of you are probably aware of this, but as I said, it's 101. So the ACA, the intention was for that to be covered by Medicaid. However, the Supreme Court ruled that you couldn't force states to expand Medicaid. So typically what happens in Medicaid is states have to abide by the rules, or they lose their Medicaid funding. The Supreme Court ruled you can't take their funding away just because they don't want to expand to this new population. So it essentially became optional whether you expanded Medicaid or not. And Texas is still one of, at this point, gosh, it's only 12 states? I think we're at 12. Missouri just voted to expand last month. So we're one of very few states who still hasn't expanded Medicaid. So we do have in this group about 1 million Texans who don't have access to anything. And that's a very unfortunate piece. And that's something you'll run into as you're trying to enroll people into ACA coverage. You'll find some folks that just aren't eligible for anything. But then at the poverty line, they are eligible for the ACA subsidies. Now, this is something that I do an entire 1.5 hour training on. So we're just going to go over it really lightly today. And if people are interested in that training, let me know, because we are actually doing that for a different Houston group later this month. And I'm happy to share the recording. So if in Texas, we limit our Medicaid eligibility for adults to a very small population of, to citizens, or a very small population of non-citizens. So most non-citizen adults are not eligible for Medicaid in Texas. I'm going to say that one more time. Most non-citizen adults aren't eligible for Medicaid in Texas. If you're a child, as long as you're not completely and entirely undocumented, you're likely to be eligible for Medicaid. The only exception being sort of some of the temporary visas, like a visitor visa or a tourist visa. But for adults, we keep it to the bare minimum that's required by federal law. So the folks who might be eligible as adults, again, they're likely not eligible just because citizens aren't eligible. So let's, thinking of Medicaid for parents, for example, could be refugees, asylees, those humanitarian statuses, or folks who've been living in the United States and working here for 10 years, and they have 40 quarters of coverage. So those are the only exceptions. Most non-citizens don't get Medicaid. And even if we expanded Medicaid, and we filled in this coverage gap, they still wouldn't get Medicaid. So the ACA knew that that was true for 6 states. We're one of 6 states that still have that very strict eligibility for adults in their Medicaid programs. They knew that that was true when they passed it. So they actually, there is a piece of the law that allows non-citizens to get ACA coverage all the way down to 0 income. Unfortunately, it doesn't scale up as you go down past the poverty line. So they're paying at 0 income the same amount someone would pay at 100% of the poverty line, but at least they have some level of access. And as we know, sometimes those plans could be nearly free if they get like a bronze level plan, which isn't great coverage, but it's better than nothing. So I just like to point that out, that there are non-citizens who can get ACA coverage, and the people who are in the coverage gap are primarily US citizens. One thing that helps to remember that is that's actually one of the reasons why Arizona expanded Medicaid. They're a fairly conservative state and were at the time, but they didn't want this discrepancy where US citizens had less access to a government benefit than non-citizens. So that's one of the reasons they expanded Medicaid. So this is how it all fits together. But today I've talked a lot about the ACA and sort of what the intention was, but today we're going to focus, that was sort of the bridge from what Aurora talked about earlier this week. We're going to focus on Medicaid. So Medicaid in Texas is because we have not expanded Medicaid, we are primarily covering children. There are 4.5 million Texans who receive Medicaid. 3.6 million of them are kids. So it's important that we remember these, because a lot of times, I don't know that everybody understands this. So we're talking about Medicaid in Texas, we're talking about kids, we're talking about pregnant women, we're talking about people with disabilities, we're talking about people over the age of 6, very low income people over the age of 65. So, you know, overall, fairly vulnerable populations. So most of them kids, we've got maternity coverage, so you're eligible for that if you're pregnant and below about 206% of the federal poverty line. We'll go through the exact income limits in just a minute. We've got very, very low income parents, as we already talked about. We have some people who are over age 65 who have a low enough income that they're also eligible for Medicaid. People with disabilities. There's a couple groups of that. Some of them are kids and some of them are adults. And then we've got CHIP. All right, I see something pop up in the chat. Here we go. Okay, great. I will make sure, Jennifer, you get the extra information. So that's how it breaks down. Another important just point, and this is just to try to emphasize how important Medicaid is to Texas, is that about half of Texas kids, 46% of Texas kids, get either Medicaid or CHIP. That's an incredibly large amount of kids. So, you know, you really can't ignore the importance of this program in Texas if you care about the health of kids in Texas. So the income limits, you know, we've gone over this pretty well already, but just so people have it in their mind, if you're a pregnant woman, it can actually go all the way up to 203% now. I know these seem like really weird percentages, but they were adjusted somewhat after the ACA, and that's why you end up with some that are really kind of odd, not nice and round percentages. But pregnant women, about 203%. Newborns, so if you're in your first year of life, your income limit is higher as well. If the younger kids, so age 1 to 5, go all the way up to 149. The older kids, 6 to 18, go all the way up to 138. And then again, these are your Medicaid limits. So if you look over here all the way to the right, the CHIP limit goes all the way to 206. So if you were one of these kids that's ineligible because your income is above one of these limits, should just go into CHIP as long as it's below 206. For parents, it's way down here at 18%, and then these are sort of roughly created. Most of these are dollar amounts, but we translate them into FPL limits just so you can compare across the programs. One of the things to just point out here, the reason our parent income limit is so low is because it's actually tied, if anybody's been doing this for a long time, there used to be a program called Aid to Families with Dependent Children, AFDC. That changed with welfare reform in the 90s. So after that, those programs became TANF and Medicaid for parents and caretakers. But this old limit was tied to that old program, and it was set by the legislature in 1985 and has not been updated since. So it's actually a dollar amount that we then convert into a FPL limit, again, just so you can compare across programs. Okay, so that's sort of the wonkier policy piece of it. We're going to get a little bit back into the policy in a minute around how the COVID-19 policies some of the policies have been updated during the pandemic, because that's an important thing to note if you're planning on doing any application assistance. But let's talk a little process. So if you're going to assist someone in applying for Medicaid or CHIP, there are multiple channels for someone to apply for these programs. And again, some of this has to do with the history of this. Technically, you can apply for the ACA on a piece of paper. It's not something I would suggest anybody doing. You can imagine you can get it started, but you can't do plan selection via paper. So, but it looks a little different when you're talking about a government assistance program. And that's been around for 50 years. So, yourtexasbenefits.com is one of the primary ways to do that. And we're going to talk about the benefits of using the online system, but you do have other options. You can call 211. And if you select option 2, you'll get to HHSC's eligibility and benefits department, where you can do an application over the phone. You can actually finish an entire Medicaid application and do a telephonic signature over the phone. If that individual also wants to apply for SNAP or TANF, then it isn't something they could do on the phone. They could do most of it on the phone, and then at the end, the agency sends them a filled out application based on the information they gave to the call center rep over the phone, that they then sign and submit to the agency. But if you want to do just a Medicaid application, you could do it over the phone. There are paper forms. So we have the 1010 and the 1205. The 1010 is probably what most people are most familiar with, and that's because it's been around longer, and it is our integrated application. So as you can see here from the picture, you can apply for SNAP, TANF, and Medicaid all via this one form. And that's been around for quite some time and just been updated over time. The 1205 came with the ACA, and it was something that is called the single streamline application. And the idea of it was that it was just for Medicaid. Anytime you're applying for, we're going to talk about this, but anytime you're applying for Medicaid at HHSC or applying for services at healthcare.gov, you are technically applying for all programs, and the idea is that they're supposed to be figuring out where you're going to fit. We're going to go through that process in a little bit, so you better understand how that works. If you use a paper form, you can mail that in to the address on the screen. You can fax it in. I do know that a lot of people don't have access to fax machines right now if they're not in their offices, but that is an option, and it's a fairly quick option. If you have a client who prefers the paper form, it is a faster way to then submit that paper form. And then of course, you always have the option of dropping off a paper form in the benefits office. I will say, if you show up to the benefits office without something filled out, they're probably going to sit that client down at a computer and tell them to use the computer to fill out the application. And they'll give them a lot less assistance than you would get at a community-based organization. So I wouldn't necessarily suggest going to an office empty-handed, but it is still an option to just drop one off if you've already got it filled out. So we often suggest that we understand that there are certain populations where Your Texas Benefits isn't a great option because they don't have access to the internet or they don't have a device, but there are definitely benefits to using it. So I wanted to make sure to highlight those. First, it's just quicker processing of the application. It's immediately sent, as soon as you submit, it's immediately sent to the agency and just gets in their queue to be worked a whole lot quicker than if you had to wait for mail time. Also, if you already sort of have an understanding of what needs to be submitted with an application, for example, paycheck stubs, you could upload those, there's actually at the very end, once you get to the very end of the application, there's an additional option do you want to upload supporting documents? And if you do that, you do it online and upload supporting documents, you could really decrease the application processing time by doing it that way. And then it's just in general a good rule of thumb, again, for those folks who are more tech savvy and more comfortable using an online system, there's a lot built into your texasbenefits.com. I'm not going to sit here and say it's the best website ever. It's still a government built website. It still has its glitches. But you can, for example, see the notices. So if this helps if clients lose their mail. I'm terrible about keeping track of my snail mail. So this is a place where they could go in and read all of their notices. If they've ever submitted something to the agency, it would have been imaged and it is available for them to see, like a paycheck stub, for example, it's available for them to see in ytv.com. So another good reason to use it. And they can go in and do their renewal online as well, and they can report changes there. So all of these are just some great functionality that's built in for those folks who feel comfortable using the system. I will say the number one barrier to getting into the system is just folks forget their passwords. So I would encourage anybody using this to maybe create a little card for them to write their username and password on and keep in their wallet or something along those lines so they can just refer back. It's just like a lot of other things. For example, every year when I do my taxes online, I forget my password because I haven't done it for a year. It works the same way with benefit applications that you only have to touch once a year or once every 6 months, depending on which programs you're receiving. I don't know. I haven't done my SNAP renewal in 6 months. I don't remember what password I used for this website. So it's always a good idea to write that down. It's one of the main barriers to getting in. I also wanted to just highlight that there is an app available. I will say I've heard that more clients are comfortable with the app. And that's some of it is just because the phone is their major way to connect to the internet. And they're used to using apps. So in the app, you can log in and set up an account. You can view your case details so you can see what benefits are still active and what applications might be still pending. You can report changes. You can go in there, and if you just need to update your address, you can do that right there on the phone. You can find offices near you. And this is the kicker. I think this one is what makes the app really useful for clients is you can upload images right there from your phone. Sending an imaged documentation is by far the fastest way for the agency to get it. But this will connect it to your case. So it immediately gets linked to that case, and you don't have to worry about trying to get whatever picture you took on your phone into your computer. It's one-step process. In fact, you can take the picture right there in the app. It's not perfect. It's not, like every app, it can be a little glitchy, but I do think that this is a great way to have this app in their phone where they can submit documentation. So if you're working with them over the phone and they're saying, the agency says they need my pay stubs, tell them, okay, great, take a picture on your phone, upload it. You can do it right there. And that really can streamline the process a lot. So now that we sort of talked about the software involved in applying, let's talk about the process. So first is the application section. And again, as we talked about, you can do that online or using the either single form or integrated form. So after application, oftentimes what will happen is that the agency will ask for documentation of what you reported on your application. I will say with the ACA, the agency is required to use electronic data first. However, what I hear from the field is that they don't do that nearly as much as they should. So for example, they should be able to verify someone's citizenship using access to the birth verification system here in Texas. So they have access to birth certificates through an online electronic source. Do they use that all the time? No. So be prepared to still submit a birth certificate if this is the kid's first time. They shouldn't have to re-verify citizenship every time they renew coverage or every time they apply. Once it's been verified, you don't have to re-verify it. And there are some programs like pregnant women and kids where they have to provide less documentation than if someone were applying as a parent, for example. Parent in this documentation phase is also an interview if you are a parent or a caretaker. We're going to talk about that is currently not happening because of COVID, but we'll get into the COVID specific policies in a minute. Typically, a parent would need to interview. That is always done over the phone. They can't require an in-person interview. CHIP waiting period, occasionally, this doesn't happen very often. We have a ton of exceptions, but if you do have a kid who just recently dropped their private health insurance, they may have to wait 90 days before they can get into CHIP. In that 90 days, they are eligible for the ACA while they wait for CHIP. It doesn't work very well. It's pretty hard to get yourself enrolled in that 90 days and then switch over to CHIP, but technically that's how it's supposed to work. I will say most kids don't have to do this. And that's because we have so many exceptions to the rule. The number one being, most people don't just drop their private health insurance, right? Sometimes you lose it because your parents lost their job. So that's a big scenario right now. In that circumstance, you wouldn't need to wait 90 days. If their parent lost their job and therefore lost their private insurance, you could get that kid directly into CHIP. They don't need to do the waiting period. So once you're through that, then there's enrollment for Medicaid. It's seamless. They may need to select a plan. If they don't select a plan will be selected for them. For CHIP, if they're at a higher income level, they may have to pay an enrollment fee of $35 for the year. And then there's this period called reasonable opportunities. So there may be a situation where a person during the documentation phase, they were able to verify everything for the agency. They've got their income, they know they're eligible, but they still are needing to provide some sort of documentation, maybe of immigration status. This can be especially true for newer immigrants. Again, for kids, we let most non-citizen children into our Medicaid program. So if they've recently arrived and they are eligible, they may have a hard time verifying their immigration status electronically, something like that. Well, technically the state is supposed to enroll them all the way into the program, and then they have 90 days to provide that documentation. It works the same way in healthcare.gov. You'll get enrolled, and then they've got 90 days after that enrollment to provide that documentation. It's really important to, when you're providing application assistance, to identify folks who have been given a reasonable opportunity period, because they may not know themselves, and we don't want them to lose coverage 3 months after they get it because they didn't know they needed to submit documentation. I will say it is much less common in Medicaid and CHIP than it is in the ACA. So that's the process for getting all the way throughout the application. As I mentioned before, the ACA did have this idea of no wrong door. So this is, again, how does healthcare.gov and yourtexasbenefits.com, how do they link together? So let's go through a few scenarios here. Let's say you start on healthcare.gov, you're providing assistance to a family and the entire family needs coverage, so you decide to start there. Well, maybe the kids are assessed as eligible for Medicaid and CHIP instead of the marketplace because they have an income of like 130. So the parents are going to be in the ACA, whereas the kids are going to be in Medicaid. So they're assessed as eligible for Medicaid. They're, oh, I'm sorry. The first scenario is ineligible. So they're ineligible for Medicaid. Then everybody goes through that. You can finish through healthcare.gov. The second scenario is you start at the marketplace. Again, you're assessed as eligible for Medicaid or CHIP. You get transferred over to HHSC. So that's actually what happens. And in most scenarios, what happens is the parents stay and they finish the application in healthcare.gov, and the kids' informations get transferred to HHSC. HHSC is going to pick that up. It's going to look a whole lot like an application that was submitted on yourtexasbenefits.com. They're going to process that application, and most likely they're going to reach out to the family for documentation, as I mentioned in that documentation phase. They're going to determine eligibility. If they're eligible, they're going to enroll the kid in CHIP. If they're ineligible, they're going to push them back to the marketplace and say, nope, not really eligible. Go ahead and finish and let them enroll in the ACA plan. If you start at Your Texas Benefits, it's going to work the same way but backwards. So first you determine eligible for Medicaid or CHIP. If you're ineligible, you get transferred to the marketplace. The marketplace will then what they do if they get an account transfer is they contact the client. The client then has to go set up a healthcare.gov account and finish that application and get enrolled. I saw the chat light up a little bit. Yes, you will be getting this presentation afterwards. Oh, we already did that. Oh, that's what your thumbs up were. You've got it handled. That's because Aurora is amazing. Perfect. Yes, you will get this and the recording. All right, so that is how No Wrong Door is supposed to work. It's not perfect. I will say that the general best advice that I could give someone right now is choose the door that you think is most appropriate for the client. So if you think that if they're adults and you think they're eligible for the ACA, go through healthcare.gov. You can certainly allow the kids application transfer to go to the Medicaid. Eventually they'll get it and eventually they'll process it. If it's more of an urgent need to get them enrolled, you may want to go do a second application on yourtexasbenefits.com for the kids, just because it's we have seen that it's a little faster to start at yourtexasbenefits.com than to wait for the account transfer from healthcare.gov to get processed. That's especially true during open enrollment. We actually had a big backlog of Medicaid and CHIP applications occur during open enrollment last year. So what happened for those enrollment assisters is they focused on the ACA during open enrollment, which makes total sense. You've only got that short window between November 1st and December 15th to get people enrolled. And then after December 15th, they followed up with everybody to make sure that their kids, if they had kids who needed Medicaid or CHIP, that their applications got processed. Many of them didn't, and they had to do a lot of follow-up with the agency because of that backlog. So I would suggest that being a process you might consider. Focus on the ACA during open enrollment, follow up with the Medicaid and CHIP kids afterwards. Nope. Got one more scenario. Okay, so I just wanted to briefly mention, we don't have to go into details, but healthcare.gov does include questions on whether or not a person has a disability that may make them eligible for Medicaid, for what, in the way that it's phrased in Texas, is Medicaid for the elderly and people with disabilities. That's how the agency describes those programs. So they'll ask about them being over 65. They'll ask about their potentially if they're disabled. And what happens there is if they're assessed as potentially eligible for this type of Medicaid, there is still an account transfer that goes to HHSC, but HHSC doesn't pick that up and process it like an application. They just mail that client the other application form, because there's an entirely different application for the folks who are eligible based on a disability. So they'll mail them that application form and they'll have to fill that out if they want to be assessed for Medicaid. Also at healthcare.gov, it's not going to stop them from enrolling into a plan just because they were assessed as potentially eligible based on a disability. They can still enroll in an ACA plan, but it's just important to know that that process happens, because it can sometimes be confusing for a client. They get enrolled in the ACA and then they get a letter from the agency with an application and they have no idea why. But that's potentially why that could happen. Okay, so now that a kid is enrolled in Medicaid or CHIP, and you've used these different application channels, what happens next? So under the ACA, certification periods for Medicaid and CHIP were extended to 12 months. CHIP in Texas already had a 12-month certification period, but Medicaid didn't. It only had a 6-month certification period. I still, to this day, get some people who think it's still 6 months long. It is 12 months long. But for CHIP, it looks a little bit more seamless for a client. So they have continuous eligibility for the entirety of their 12 months. The exception is that kids who are at that higher income level above 185, they will get an income check at 6 months to make sure that they're still income eligible. If they are, and they pass the check, they'll go on and they'll get another 6 months of coverage. And then they need to renew at the year mark. For CHIP kids who are below 185, they get a full 12 months of coverage. And what does it mean to be continuous? That means even if their income changes, even if something changes in their household that would make them ineligible, they still get to ride out the rest of the year. And then at renewal, that's when they would redetermine eligibility, see if they're eligible or not. And if they're not eligible, then they would be denied. And at that point, they would have an opportunity to enroll in the ACA if they wanted to. But unfortunately, when the ACA required those certification periods to go to 12 months, the state did not align those. So in children's Medicaid, it can get a little sticky. They get 6 months of continuous coverage, which is how it worked before the ACA. But then in that second 6 months, they have non-continuous coverage. And that means that any change in income could cause them to lose their coverage. On top of that, the agency does income checks in months 5, 6, 7, and 8. And this is part of the advocacy that both Aurora and my organization take on, is that these income checks can be very harmful, and this period of non-continuous eligibility can be very harmful. And what it ends up doing is actually kicking off eligible kids, and it's just because they're asking them to do paperwork over and over and over again. And as y'all know, anytime you put a hoop in front of somebody, not everybody's going to get through it. So we actually see about 4,000 kids a month kicked out of our Medicaid program just because they weren't able to finish the paperwork. We're going to talk about why that's not happening during COVID in just a minute, but that is how it typically works. Parents and caretakers don't get any continuous coverage. It's always, it can always change from month to month depending on their eligibility, and they get income checks through the whole thing, all the way up to month 9 when the renewal process begins. Pregnant women, they get continuous coverage. So once they're determined eligible, they get to stay in the program. They get 2 months after the birth of the baby, and then at that point they could get enrolled maybe into the ACA or some other program. It could also, if they have very, very low income, it could be Medicaid for parents, or they can end up with a coverage gap. All right, so quickly I wanted to go over the COVID related policies. So what are some of the new things that are happening just during the public health emergency related to the pandemic? One of the very first things that Congress passed to respond to the pandemic was called the Families First Coronavirus Response Act. One of the things that it did was it increased the amount the federal government pays to states for Medicaid. Typically, it's about a 60-40 match. It's a little bit different depending on the state, but it bumped that up by more than 6%. So basically, they're shelling out more, and the state is shelling out less, which is great. That's helpful for state budgets. And in fact, if they were to do another package, we would want them to increase that even further. But there were strings attached. You couldn't just get that money. One of the things that you had to do is you have to keep everybody enrolled in Medicaid. If they were enrolled on March 18th, they get to stay enrolled. You can't kick them off. So that the only exceptions are if they move out of the state or if they actually ask you to take them off the program. So everybody that was enrolled as of March 18th or enrolled after that, but during the public health emergency, they've been enrolled this entire time. They can't get terminated. Currently, the public health emergency is due to expire on October 23rd, 2020. It is a moving target. It was going to expire in July and it got extended to October. So we do anticipate it could move. It could get caught up in the politics of the election. So it's a little bit unknown what will happen come mid-October when we need someone to make a decision on whether or not that public health emergency will be extended. I will say there are a lot of different emergencies going on right now that are the decision of different people. We have emergencies that Greg Abbott declares. We have emergencies that the president can declare. This specific thing is the public health emergency, and the decision solely rests on the Secretary of Health and Human Services at the federal level. So it's not a presidential decision. It's not a state decision. It's just the Secretary of Health and Human Services. The additional thing that they have to do to get that extra money is that they have to cover without cost sharing testing services and treatment for COVID-19 for anybody who's in Medicaid and CHIP, including vaccines, specialized equipment, therapies, whatever it may be. If they're enrolled in Medicaid or CHIP and they've got COVID-19 or they need to be tested for COVID-19, or eventually when we get to vaccines, they have to cover it with no cost sharing. We don't have cost sharing in Medicaid in Texas, but we do have it for CHIP. So that's important to apply it there. So what does this mean for Texas? That means that nobody's been terminated. We've actually have every month we have more and more people enrolling in our. We have the enrollment numbers going up and up and up, and that's because nobody's losing coverage. We typically have some amount of people at renewal who are either denied because they're no longer eligible, or they just forget to renew, so they fall off the program. That's not happening right now. So our enrollment numbers have spiked dramatically here in Texas. They've also suspended the income checks that I mentioned earlier, so those aren't happening. With the exception of CHIP, you could still, none of the pieces about continuing coverage under COVID applied to the CHIP program. That's just not how that law was written. So right now what they've been doing is they've been extending those renewals out a month and out a month and out a month, so that if you didn't submit your renewal, you'll get another month of coverage, and then they make the decision later on as to what happens the next month. We don't love the month-to-month process, but it's better than nothing. But they will still get a renewal packet, and they should still fill that out. So renewals for Medicaid during the public health emergency, at the very beginning, no one was getting a renewal packet. So that was March through July. But starting in August, everybody who didn't get a renewal packet in March through July, who needed to renew, got theirs in August. And moving forward, people will receive the renewal packets on schedule. It's a weird thing to explain. They're going to get a renewal packet, but they can't get terminated. So my general advice is that folks should still go ahead and fill that renewal packet out, because it gives them 12 months of coverage, which is considerably more stable than just, I know I have coverage until the end of the public health emergency, because nobody's got a crystal ball. We don't know when the public health emergency is going to end. So if you do have clients that are receiving these renewal packets, it's not going to hurt them to fill it out. They can't terminate you even if you're now ineligible. So go ahead and fill those out and get them that new 12-month certification. I think I went over all of that. Oh, but if they don't fill it out, they miss it, they forget, they're going to give one more chance before they get terminated at the end of the public health emergency. The agency is going to give them another chance. So all of that is to get us to, okay, I get the process, the basics. What if I want to provide application assistance? I'll start this by saying, this is different than healthcare.gov. In healthcare.gov, you really are supposed to be certified as certified application counselor or a navigator or a broker to provide official assistance to somebody. Obviously, you might give assistance to your mom, right? But if you're giving assistance as an organization in an official capacity, you should be certified using one of those programs. Some of that has to do with the fact that what they're doing actually impacts their taxes. It can, you're helping them select a healthcare plan. That's something that requires a lot of training. So it's a little bit of a different process. It's more arduous. There's much more knowledge that's needed. Not to say that there's not knowledge for Medicaid and CHIP that's needed, but really what you're doing for Medicaid and CHIP is you're just helping them with an application, which is only half of the process with healthcare.gov. So I wanted to say all that because this community partner program, I think it's great. I'm going to tell you all the great things about it, but it's not a required certification. It's just a suggested certification, if that makes sense. Because again, you're just helping someone fill out an application, which is less than what you do as a certified application counselor on healthcare.gov. So Texas Health and Human Services has what they call a community partner program. Unfortunately, there's no funding tied to this, so it is a voluntary thing that you do for free, but there are definite benefits that your organization could reap if you were to become a community partner. So let's talk about those. First, you get direct support. So once you become a community partner, you are connected to the regional advisors and the state office that run this program, and they can help you through troubleshooting or issues you may have as you're providing application assistance. So that's helpful. You also get free training. So there's some web-based training, and I don't believe it's happening right now because of social distancing, but there are sometimes some on-site training that's done by the program. So this can really help you. It's similar to what I just went through just now, but even more specific to how to use the website, what are some of the troubleshooting tips on how to get an application processed. So they do really give a great job of providing that training. They also give you a nice certification. As Aurora mentioned, it's really comforting and helpful for a client to see that someone is certified in what they're doing. So it's good to have that certification. It's a comfort to the client. And if you're a supervisor, you can have greater faith in your staff that they've had the training they need to be able to do their job to the best of their ability. There are some informational resources that are available. So they give updates. There's a monthly webinar. I actually attend that webinar too, just because it's a great place to get information on what's going on each month. What is the new policy? What are some new changes on the website? So they give monthly webinars to their community partners that include useful tips and best practices. And you get access to free promotional materials to put in your office or give to clients. There's opportunities to provide feedback. So if you're seeing issues, you can provide that feedback to the agency and increase visibility. This is similar to what Aurora discussed. If you're a certified application counselor, your information is listed on healthcare.gov. Well, there is a website for the community partner program where you can search for community partners in your area if you're a client looking for assistance. So you can get listed in that website. You'll also end up in the 211 database. So if somebody calls 211 looking for application assistance for Medicaid and CHIP, they'll refer you to community partners near you. So it does increase your visibility. So there's a couple different ways to be a community partner. One is just a level 1. That just means that you have said, we have a computer in our lobby. We don't have any extra staff to go help people, but if they need access to the internet and they want to apply, we've got a computer where they can come apply. And again, that'll be listed on the website as if you're just looking for a computer where you can apply for benefits, you can go. What are examples of that? Libraries are a great place where you might see libraries can sign up to be community partners. Librarians aren't going to help with the application assistance, but they may want to be on the website as a place where folks can go to get to use their computer. A level 2 partner, this is where almost everybody is. Because they want that additional training, they want to provide the hands-on assistance to a client, but the level 3, we're going to talk about that in a minute, but it's been fairly restricted by HHSC historically. So most community partners are level 2, and that means they offer a computer, but they're also going to offer staff to sit through and do the application with the client. So most of the time when we're thinking about enrollment assistance, this is what we're thinking about: sitting next to a person while you walk through the application and fill out everything on the computer and then hit submit for them. So that's the level 2. There is a level 3. They have been broadening who it's mostly by invitation to be in a level 3, but they are broadening that. They've been piloting it and broadening it over the last year. So we do know there are several folks who are level 3 partners now. And they have to do everything a level 1 and a level 2 do, but they get an extra, basically they get access to what we call an assister portal. And so they have some extra functionality within their yourtexasbenefits.com access that makes it where they can see additional information about the client, things like what notices they got, if they were told that they needed to provide extra documentation, what was it? These are things that you can always ask the client, but it can be a little bit hard to the client doesn't always understand what they're being asked. So if you're getting information only from the client, it can be hard to understand what the client is trying to tell you. So this can help you by being able to access more of their case information right there in your portal, as opposed to just through the client. So this is something that a few folks have been upgraded to. Specifically, the Connecting Kids to Coverage grantees were provided the opportunity to upgrade to level 3 partners this last year, and several community health centers, and the agency is looking to expand it more. There was some functionality and security issues for years that prevented them from really being able to expand this level of the program that they have since overcome, and they're now in the process of expanding its reach. So we think that's a really positive step. So there are some requirements. Primarily, I just want to point out that anyone who is working on your staff and wants to become a navigator, I hate that navigator is used in more than one space because it gets very confusing, but we're talking about the community partner program navigator. They do have to go through a criminal background check. It's free and the agency will provide them the link to do it, but they will have to do that criminal background check. So it's important that I just wanted to point that out. That is something that they have to get through in order to be certified. Okay, so what do you do to be a community partner? You can go on to the texascommunitypartnerprogram.com. This is their website. There is an enrollment form. It's an electronic form. You can start there. It gets the ball rolling. Staff will reach out to you. They'll help you get your organization, just like in healthcare.gov. First you certify your organization, and then all of the people who work for you, who you want certified, they go through the training and they get certified individually. So you start with the organization, and then you certify each of your staff. So they do have to go through an approval process. So it's not going to be automatic. So when you submit the enrollment form, they're going to reach out, they're going to ask some screening questions just to make sure you meet the criteria. Most community-based organizations do. But then they'll enroll you and you'll have access to all the training and resources that I just described. And that gets us right at the hour to the end. So I'm happy to answer questions if folks have them. I don't see anything yet, but also feel free to raise your hand if you need to. I'm going to stop the screen share for now so I can see participants a little bit more. But if you want to ask a question out loud, I can also unmute you. Anybody got a question? Well, don't feel like you can't submit one, but I've got a little bit of wrapping up, just a few reminders. So this is part 2 of a 4-part series. So next week, we're going to dive deeper. This week was just meant for 101. If you've never done this before, let's help you figure out what it looks like. What are the certifications you can get? What's the lifting that you would need to do to get your organization ready to do this work? Next week is much more targeted. If we're living in a time of COVID-19 where many people, like myself, you can see my bedroom in the background, we're all working from home. So what is it like to give enrollment assistance working from home? There are very distinct differences between what you can do on yourtexasbenefits.com and what you can do on healthcare.gov. And that's because it's 2 different agencies that regulate those sites. Healthcare.gov is the Center for Medicaid and Medicare Services. So CMS is the federal agency. yourtexasbenefits.com is the state Medicaid agency, Texas Health and Human Services Commission. So, that's why we've split this up. And so Aurora is going to start next week on Monday with going over healthcare.gov and how to do remote enrollment assistance into the ACA so that you're prepped and ready to go for open enrollment. I'll follow up later in the week with the challenges and tribulations of trying to give remote enrollment assistance for Medicaid and CHIP. I will say it's significantly harder. So spoiler alert there. So that's what our final 2 are. Another reminder, and we'll be sending this out to all of the participants. I did it yesterday. You would have gotten an email if you participated earlier this week with this in it. You'll get it for this one as well. The Young Invincibles does have a virtual planning summit to help organizations prepare for this very unique open enrollment period that we're about to go into during a public health crisis. So they're doing that planning summit next week on the 17th. So again, you'll get a link to register for that in your follow-up email for this webinar. And then later on in the month, every Texan, Young Invincibles, and the Texas Association of Community Health Centers will be hosting the Texas State of Enrollment Conference. We do this as an in-person conference from enrollment assisters every year. But this year we're going virtual like everything else. So we do have 3 days with 6 webinars. It'll be a sprint. You don't have to go to all of them. They'll all be recorded. But we'd love for folks that want to get a deeper dive into different programs to sign up for that. Again, in the follow-up email from this webinar, there will be links for the website for that event, which there are 6 different webinars associated with that. You do have to register for each individually, so you can pick and choose what you like. Aurora, did you want to add anything? I'm sorry I kind of stole your thunder on your planning summit, but let me know if you want to add anything.
No, not at all. I dropped the links to the rest of the sessions that Melissa and I will be hosting next week in the chat. I've also put a link to the Texas State of Enrollment Conference in the chat as well. So please go ahead and register for those of you who haven't already. But yeah, I'm thankful everyone was here with us today.
Yeah, thanks for taking the time to get nerdy with us in eligibility policy, and we look forward to presenting next week. And in the meantime, y'all have our contact information. We're happy to answer any questions you have offline as well.
Yeah, thank y'all so much.
Have a good weekend.